Hi, I'm Amy McDowell. I'm a physical therapist here at ARC, and I'm going to show you a hip flexor stretch. The hip flexors are an important group of muscles to try to keep flexible because they bend or flex your hip by pulling your thigh up towards your body. But if your feet are planted and they're too tight, they can pull your body towards your legs, which can compress your back and even change the alignment in your legs. It's hard to sometimes get a proper stretch of your hip flexors because your body can tilt or twist to avoid stretching the tightest area. So I like to have my patients use a doorway or a corner to help them keep proper alignment when they're stretching. You're going to put the small of your back in against the wall and be very close to the edge. You'll need to get your feet a little bit away from the wall and soften your knees. Your tailbone should point towards the bottom of the wall and your ribs should relax. Then you're going to reach one leg straight back. And as you reach it back, try not to twist your back or your opposite hip out of position. Once you get your leg back there, you're going to try to straighten your knee as much as you can, tighten your bottom, and lift up with your stomach muscles. You should feel a stretch in the front of your hip. If you don't quite feel the stretch, you can make your stride a little deeper. Once you feel the stretch, you want to hold it at least 10 or 15 seconds. I usually tell patients if they just want to loosen up before they play a sport or if it's the beginning of the day, just stretch less than 30 seconds on each side and do each side a couple of times. But if you want to get a lasting stretch and it's the end of the day or you're done playing your sport, then you can hold the stretch at least for a full minute.